Hi, my name is Richard Isaacson. I'm director of the Alzheimer's Prevention Clinic at Weill Cornell Medicine and New York Presbyterian. Today, we're going to be talking about endpoints in Alzheimer's disease clinical trials. Let's talk about the Verbal Fluency Task Score as an outcome measure in Alzheimer's disease clinical trials. Both semantic and phonemic fluency tests can be used to assess cognitive function in Alzheimer's disease. And I think one of the most common tests that we think about when we think of semantic production is something called category fluency. Category fluency or semantic fluency is in terms of the classic test that's used for Alzheimer's disease screening as well as longitudinal monitoring in both trials and in clinical practice is the classic sentence, name as many animals as you can in 60 seconds. And I find this to be extremely helpful in clinical practice because, again, Alzheimer's disease is characterized by progressive short-term memory loss, but also changes in language, behavior, other aspects. And a language assessment specifically related to animal naming has been quite helpful in trying to deduce the potential cause. And also, it's been helpful when we can follow this metric over time. Phonemic fluency is a little different. It's also associated with decline related to Alzheimer's as well as decline related to other aspects and other diseases. But if you can name as many words as possible, for example, with the letter F in 60 seconds, in our clinical practice, we actually use FAS. We do it 3 rounds of F, A, and S, and then we combine that, and then we look at the age and education adjusted norms for both this as well as the semantic fluency or animal naming. The advantages to these types of tests, verbal fluency, particularly semantic fluency, is that it has been shown to correlate with the severity of Alzheimer's disease and also associates with the risk of progression to dementia. In our clinical practice, we see people very early in the cognitive decline spectrum with very minimal cognitive changes. And this is something that I can really kind of hang a hat on in terms of can this be a reliable outcome? And if a person comes in with short-term memory loss and we do cognitive testing and they have problems with short-term memory and they have problems with animal naming, those are things that say, you know what, this person may be at a higher likelihood to not only have Alzheimer's disease as the cause, but they may be at a higher likelihood for progression to dementia, even when they have just minimal symptoms to start. It only takes a few minutes. An animal naming test, 1 minute. F letter words, 1 minute. Add a couple more categories, F, A, and S, for example, only a couple more minutes. It's widely used in clinical settings, and I really believe it's helpful both in clinical practice as well as in clinical trial. The problem with this in terms of limitations, education, premorbid IQ, also language. What is a person's native language? If it's not English and you're testing them in English, the scores may be surreptitiously low. When it comes to other socioeconomic factors can definitely play a role, so we need to be cautious in terms of certain cultural contexts.